It all started with a lot of headache and a lot of fatigue, then a runny nose and a horrible cough.
Aliona
Um,
Besanoff has been sick in bed for weeks. One of many Ontarians refused a test for COVID-19.
there's so much dependent on that test, and unfortunately, you don't get any answers, right?
Ontario has Canada's lowest rate of testing per capita. To try to fix that, the province now plans to proactively test high risk and vulnerable groups, including healthcare workers and people in shelters.
The sooner we can identify cases, the sooner we can act, contain cases, and stop the spread.
Testing is also being expanded at long-term care homes. The province now says all symptomatic residents should be tested, along with asymptomatic residents who may have come into contact with someone who is sick.
Local public health officials.
It's not enough, says this epidemiologist, who argues testing should include all care home residents.
We know this is a wildfire that's raging in chronic care institutions. We need to put it out, and we can't put it out if we can't see it.
At first, Ontario struggled with a backlog. Now it's not even meeting its capacity. Alberta and Quebec are testing at more than twice the rate of Ontario based on population.
What we really need is we need a snapshot of where we are now. The testing has been such a mess for so long that we really are relying on lagging indicators to tell us where we are in this outbreak.
While the new plan is to test up to 16,000 people a day by early May, it likely won't help Aliona Besanoff, who isn't in a priority group.
If you do know it's COVID, I guess you know it and you deal with it. If you know it's not, then you get this huge relief.
Like so many, she may never know either way. Ellen Morrow, CBC News, Toronto.